Hello, my name is Shelly Sowers. I'm an instructor with UMA. I currently teach in our ME MOBS program, and I hold degrees in medical assisting, health service administration, nursing, psychology, and also business. Today we are talking about anxiety and the fearful client, which all of us at some point will work with patients that are anxious or maybe fearful, or maybe we've been patients ourselves at one point where we have been anxious or fearful. Now let's look at our agenda for today. We will describe the 4 stages of anxiety and appropriate therapeutic responses for each of those 4 stages. We will describe the behavior of a fearful client, develop therapeutic responses or approaches for dealing with fearful clients, list the signs and symptoms of a client that's experiencing a panic attack, and also discuss a therapeutic response to the client experiencing a panic attack. So let's get started. What is anxiety and fear? Anxiety is a normal response to stressors that we come in contact with every day. So every day, each of us have anxiety. It could be something related to a positive event, like maybe the birth of a baby or an upcoming wedding, or it could be in response to a negative stimulus, maybe the death of a loved one. It is a feeling of apprehension, worry, uneasiness, or dread, and it's frequently accompanied by physical symptoms such as nausea. Anxiety is different from fear, however. There is a difference. Fear is the reaction to a known. So something that we have been in a situation before and we can relate to it, and it's usually an external threat. Anxiety, on the other hand, may occur at any time. It may come on unsolicited. We're not expecting it. Even there's situations where we may not know what we're anxious about. Our body knows that we're anxious about something, but we may not know. And this develops from within, and it may be triggered by any situation. The level of anxiety, however, is key. There are 4 levels of anxiety. We will talk about each of these. The first one is mild anxiety. The second is moderate anxiety. The third is severe anxiety, and the 4th is panic anxiety, also known as a panic attack, or can coincide with a panic attack. So let's first talk about mild anxiety. This is routinely experienced in everyday living. As I mentioned earlier, we may experience this every day, all of us. It is considered healthy as it does increase our perception. During mild anxiety, our body does function well. It is stimulated by the increased production of things such as adrenaline and also cortisol, also known as the stress hormone, which enables us to think clearly. It helps us focus on details. It helps us to be alert and be organized, efficient, and it also assists us in making wise decisions and judgments. While experiencing mild anxiety, however, memory retention and learning are heightened. The therapeutic responses, we're going to talk a lot about therapeutic responses during this presentation. And the reason we do that is because we need to look at all of the possibilities of how we can respond to someone in this particular situation. So regardless of what your role is in healthcare, we're going to experience these things. Let's say if we're working in a clinical setting, we're going to have patients that are anxious or fearful, right? If we are working in an administrative setting, maybe with billing and coding, we will still have patients that are fearful or anxious about maybe a bill that they got in. So therapeutic responses to a person that's experiencing mild anxiety include providing details for healthcare and instructions and offering choices. That is so key, and it really works well with all age groups, which we will look at. It works well with all age groups, giving choices. And we also want to provide those details, maybe provide the patient brochures. This works especially good with the older adult, to provide pamphlets or brochures where they can read more about it when they get home. We know that technology works best with people that are younger. And that's just how our society is. And so we do try to provide those handouts to our older adult population. Okay, and let's go ahead and let's next talk about moderate anxiety. So moderate anxiety, the person experiencing moderate anxiety will have a decreased perception. So this is different than what we looked at with mild, where it's going to have that heightened perception and we're going to be alert and be able to think clearly and make good decisions. Their focus is on a particular task or problem rather than the overall circumstance at hand. When experiencing moderate anxiety, the individual will still be alert and they're able to think clearly. Concentration, however, will be focused on one challenge at a time. Decisions and judgment will be made on each individual details as it's experienced or as the person becomes aware of another detail. So if we think about that, essentially with moderate anxiety, you're moving from one detail to the next. That individual can only handle one set of details, right? So they're not probably going to jump back and forth. They can only focus on that one set. Our therapeutic responses include focusing on one detail at a time because that's how they're approaching things, so that can help them. Speaking in a soft, calm manner, that will keep the entire situation calm and help to decrease the anxiety. Encouraging relaxed breathing techniques. Maybe ask the patient to take 3 deep breaths and close their eyes and just, think about something that calms them. And keeping the person informed regarding how much longer the procedure will take. That's a huge thing. When we have a patient that's anxious, especially if it's about a procedure, what they're thinking about at that moment is, when is this going to be over? If we keep them informed step by step of what we're doing, how much longer the procedure might take, what to expect, they feel in more control, which will decrease the anxiety. And that's a natural response to anxiety is a lack of control. So we want to give them that control back, right? Give them that power back. And we can do that by informing them. We can also, of course, let them know, when is that discomfort going to be over? How long is it going to last? So empower them with knowledge, and that will decrease their anxiety. Now let's move into severe anxiety. And you're going to see the differences of how this affects the patient. Severe anxiety, during this, individuals will experience an inability to focus on the details. So whereas we saw with moderate, they're going to focus on one set of details. Whereas the person with severe anxiety, they might not be able to focus on any details. Or they may be able to focus attention only on one aspect of a situation. Abstract thinking at that point is lost. Our therapeutic response, because we know at this point concentration's kind of out the window, right? If we're giving any kind of patient education or explaining a bill to them, they may be getting some of that information, but it's not likely that they're getting all of it. So we have to work with just one detail at a time. Therapeutic responses, specifically with our severe anxious patients, include giving detailed instructions. So they might need to be really detailed so that they understand that, to a family member, or we can actually write them out for the client. Give clients brochures or pamphlets to read after they have had time to gain self-control and they can absorb that information, maybe take it home and read it. We can telephone later in the day or the next day, and you may have had this happen if you've had some kind of procedure. They might phone you the next day to check in with you and see how you're doing. They do this a lot with outpatient surgeries or even dental procedures. The dentist might call and check in on you. And then during that time, of course, we also want to ask them, do they have any questions, or are there any concerns? And before they leave, let's make sure that they understand what to look for. If it was a procedure, okay, well, what kind of things are you going to look for? And we're going to give them as much handout information that they can take with them as possible. So what is panic anxiety? This can occur with little or no warning, and most often is a response to some type of stressor. So let's kind of put ourselves in that place for a minute and kind of zone in here with me. Let's think of a situation where you've had a stressful response, and maybe it's us being at home with the kids. Maybe it's the housework. Maybe it's all of the hours that we're doing at work on top of our schoolwork. And, there's a lot of sacrifices in that, right? And a lot of stressors. we're trying to reach a goal with all of it, but there's still a lot of stress that comes with it. Remember, positive stress and there can be negative stress. So you got to take the good with the bad. But this can come on with no warning, and it could be due to maybe stressors we've had all day, and then all of a sudden the person just starts having panic anxiety. The individual during this time may experience a racing heart rate, shortness of breath, and they may feel that they've had some life-threatening illness or have some life-threatening illness. And I'll tell you, if you've had panic anxiety, and I've seen a lot of patients with this, the symptoms that come on with it, such as the shortness of breath, the tachycardia, which is the fast heart rate, that actually makes it worse, because at that point the patient's thinking, okay, what's wrong with me? Something's wrong with me. They think that, they have some type of life-threatening situation going on. These symptoms are generally short-lived, however. That's the good thing. They're generally short-lived. And once the stressor is gone, the anxiety and symptoms will disappear. One thing that we can ask them to do, and this is not listed here, but we can ask them, if we do not have a bag for them to breathe into, we can actually ask them if they can breathe into cupped hands. And it will simulate what we would do with a bag if a person is having hyperventilation or breathing issues. So if you notice that the patient's hyperventilating and we need to really get that breathing back to normal, we can ask them to breathe into a bag or cupped hands. During the panic anxiety stage, communication may be difficult. Rational thinking at that point, all they're thinking about is, I can't breathe. My heart's racing. I don't know why I feel so overwhelmed, and they feel like they've been taken over. Rational thinking and concentration is hugely diminished at that point, so we need to keep that in mind. Patient teaching at that moment is probably not a good idea, right? We probably want to wait until later when they can think clearly and actually absorb what we're saying. Panic anxiety, it can be hereditary, or it can be the result of life experiences. And typically, if you research this and read more about it in your textbooks throughout your program when this comes up, you'll see that there is a relation to our past experiences, even if we may not have realized it at the time, that later this was going to, be a traumatic situation enough for us, or something that stuck with us enough in that moment to give us anxiety 10 years later. One example would be a situation where someone is afraid of needles. They may have had a situation when they were little that in that moment it felt traumatic and they had a really bad response to it, and then years later it can still affect them. So what are our therapeutic responses when we're dealing with someone that has a panic anxiety situation, in addition to the cupped hands or using the bag if they're hyperventilating? They are the same as what we would do for severe anxiety. Talk calmly, talk slowly, do what we can to comfort them, reassure them, empower them. Those are things that we definitely want to focus on. And it's important not to allow a person in this state to leave the clinic until they recover. So until they've settled down and they can come back to where they can abstract think again, we probably need to suggest that they stay there with us and, watch them and comfort them. And then they can maybe have someone else drive them home. Or if they feel comfortable and you guys feel comfortable, then you can make the decision and they can go ahead and go home. Now let's talk about the fearful client. So fear is an emotion. And everybody, let's think about a time that you've been fearful. So this is different than what we talked about earlier. It can be in relation to fear, but there is a difference. So fear is an emotion that's aroused primarily by something you are uncertain of, or by some sort of threat, whether it's a real threat or an imagined threat. And my experience is that most of these threats are real, in the sense that, let's say if someone is afraid of a tsunami, they may have it's a real threat in the world. It may not be necessarily a real threat in their area, but they are afraid of it and they have a true fear of it. So there are different degrees of fear, and fear will vary definitely with each individual. It's not going to be the same with everyone. Fear, unfortunately, it can lead to social problems if not appropriately addressed. And I'll give you an example. I had a patient once, and you may have seen this on movies, or may know someone who has had a fear of things like elevators or stairs. Imagine all of the places you would have to avoid if you had a fear of elevators or stairs. Think about how that might hinder your life as far as where you can go. If you needed to visit someone in a hospital, how would you get there if you couldn't go up the stairs or go up the elevator? So it can significantly impact someone's life. And intervention early, if the fear is that severe, definitely needs to happen. There's a lot of different things that can be done for someone that has a fear that is debilitating or impacting their life. Fear has many definitions, but some are distrust, worry, dread, fright, paranoia, or even terror. Terror is one of the ones that's more severe. That would be a situation where the person absolutely could not go near the elevator or near the stairs. All right, let's talk about specifically distrust and worry. So distrust and worry are emotions that usually focus on a person or an object. So the fear is gone when the person or object disappears. If it's not there, they don't have the fear. For example here, when a client is fearful of a blood draw, distrust of the laboratory technician and worry about the discomfort could induce that fear that they have. Once the blood is drawn though, and the Band-Aid's in place, the client leaves the area, the fear will start to subside. So it's a give or take here with this distrust and worry, but once that is away, the fear and distrust and worry will subside. Now, what about dread? Dread is the fear usually experienced prior to the event. We've all been in that situation where you have something coming up that maybe you don't like, somewhere you don't want to go, and you dread it. And sometimes you dread it days in advance, weeks in advance. I think about how much energy that takes from us, right? How much energy does that take, and what does that take away from our life currently when we dread things? A client who shrinks back when a nurse approaches the hospital bed with a syringe in their hand knows what's coming and they dread the event. So that's a good example. They're dreading that. Or if they know they're getting an injection later, they're dreading that coming. Now, what about paranoia? This is a psychosis of fear that is related to a feeling of being victimized in some sort of way. It can cause irrational, or it can actually also cause compulsive behaviors that can be debilitating as well. And that's something that definitely needs to be addressed if the patient is experiencing any kind of paranoia. Denial of fear. The client's denial of fear. How many times have we said, I'm not afraid of that. No, but maybe we really are. So the denial of fear may be an unconscious defense mechanism, an attempt to protect oneself by blocking an emotionally painful experience. People using this mechanism are unable to recognize the cause of their discomfort, and they may even deny being frightened or fearful. In a lot of cases, they don't realize that they are afraid of something. They don't realize why they're afraid of it in some cases, if they are in fact afraid. These clients tend to be hypercritical of the treatment and unusually demanding. It's difficult for these clients to accept help from caregivers. So if you get that pushback, just know that might be denial of fear. Since to do so, they have to acknowledge that they're fearful in order to accept the treatment or accept the medical professional's advice and so forth.